What to expect before your CT scan. You have arrived at the radiology department and you have checked in. So what's next? Once you are called by the radiographer into the X-ray room, they will now confirm your identity again. Once this process has been completed, you will be given a gown to wear during your scan. The radiographer will also request that you remove any form of jewellery, piercings included, or hair accessories that you might have on, like hair clips, headbands and hair ties. This is common procedure to ensure that your scan is not obscured by any artefacts you might be wearing. The radiographer will temporarily leave the room to give you privacy to change. Once you have changed and removed all the artefacts you might be wearing, the radiographer will now return to the X-ray room and begin running through some basic questions with you to ensure that they can begin with your CT scan. The following questions may be asked. Have you recently had any surgery? Please give full details regarding any surgeries. Is there any possibility you could be pregnant? Are you currently on any medication or antibiotics? Once these set of questions have been answered and the radiographer is satisfied that you meet all the conditions for the CT scan, your CT scan will now begin. Before your CT scan begins, the radiographer will position you on the examination table. You will most commonly be positioned on your back or in supine positioning. Your arms will be positioned at your sides. Once the radiographer has positioned you on the table, they will then leave the room and enter an adjacent room where they will stay for the duration of your scan. Don't panic. The radiographer will be able to see you, hear you, and communicate with you for the entirety of your scan through an intercom system. You will never be fully enclosed in the scanner during the scan, as the scanner is open at the back and the front and will only be positioned above your head. Before the scan begins, the table will move up and into the scanner. Next, the table will move once through the scanner to determine the correct starting position for your scan. Once this has been completed, the table will now begin to slowly move back and forward through the scanner. This process may be repeated several times. During the scan, you may hear some noises like buzzing, clicking and whirring. Do not be alarmed. These noises are associated with the CT scanner's tubes and detectors circulating around you. In 90% of cases, the scanning process should take a maximum of 30 seconds. You must stay very still during the scan to ensure the images we take are not blurry. The radiographer may also ask you to hold your breath during the scanning. They will practice this with you before your scan begins. They will also communicate this with you through the intercom system. Once the scan has been completed, the radiographer will ask you to wait for 2 to 3 minutes while they ensure the scans are of high quality for an efficient and correct diagnosis. The bed will now move out of the scanner and be lowered by the radiographer, who will now re-enter the room. At this point, your scan has been completed and the radiographer will return your clothes to you and your artefacts. You may change out of the gown and wait for further guidance. You are now free to return to daily activities once you've left the CT department. Your scans will now be sent to the radiologist, who will analyse your scans for a diagnosis. If you still have some questions, please visit the FAQ tab on our website, where we will happily answer them for you.